Well, greetings. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going back now and kind of touch on something here that's Straightwise Orthodontic Course, lesson number 49, Diagnosis and Treatment Planning in General Dentistry. Now, I am one that believes that everybody that's doing dentistry ought to know something about orthodontics. They ought to tell you what can be done and what can't be done, and if you want to do it, you should go after it. And that would include every bit of dentistry, from pediatric on through as long as people live. Learn what you can do, and you do that. And when you get good at it, you take on something a little more. The case that I'm going to show you here now, we started out, and it looked like a very simple case, but it can fool you. It can fool almost anybody looking at it. So let's get started, and I'll go through that case and show you what I'm talking about. This young lady has a class 3 malocclusion. It's a very mild class 3, and you see here these front teeth right across here on the lower arch are out in front with the front teeth up here. And this is a definite class 3 problem, you see. And so she's not having any problem. She can eat like that and everything else. So she came to us and wants to correct this problem. Well, we can correct it. It's not very difficult to correct it at all. And so I want to run through this real quick and try to explain it to you, how you can correct this type of problem. And this is what we call Straightwise Orthodontics. You get your problems with a case and learn what can be done with that particular or as many problems as they got. And she's got a crossbite over on the right side of the mouth also. Now, so we've got a bite that closes further. You see where it is here, and when she closes down, you see the teeth in this position. So we thought, this is simple. We'll just put something in here on top of these bottom teeth, and we'll get this young lady to and we set up something here, and we expanded these teeth, put them over on the other side of the teeth, and let's kind of run through and see what we did here. All right. You can see how the upper teeth fit down in this area right here. Now, when you look at it from the inside, in other words, you take the models, you look inside them, and these are the upper anterior teeth fitting in there in that crowded situation. So we're going to have to open the bite, to get this in. So we straighten up these teeth right here, and we come in and put an arch wire in, and we put some expansion loops on it back here in the back, and we push on those teeth, and we get them to come over on the correct side of the mouth. And then we turned it loose, and they went down, the bite closed back up again, and these teeth come back down a little bit. So we put something in here to keep it open so they would stay in that position. Now we went along for a while, and then can you imagine what takes place by us doing this? And people are always asking you, does the occlusion, can it be involved with a TMJ problem? A lot of people don't realize it can. All right, what happened by what we did here, we pull these teeth over on the right side, and then they tended to close back down again. As they did, they caught the lower teeth, and they made the jaw go distal. Well, if you push the jaw back at all, condyles are sitting back here at the last. Just think about both condyles on the jawbone back here, and it pushes the condyles back into this soft vascular tissue called the retrodiscal tissue, which actually lubricates and feeds the joint on somebody. And she came down with a TMJ problem. Well, if I hadn't understood that, I would not know what caused that TMJ problem to take place. But it did, and she started having terrific pain in the joint. Well, what are we going to do to that? Well, what we needed to do was advance the upper teeth so that when the lower teeth came in contact with them, they would not be pushed back so that the condyles wouldn't go against the retrodiscal tissue back there. And so we expanded that some more and opened the gap in the teeth, expanded it, brought it out, and it worked on her. We were able to get the TMJ thing fixed in her. Now I'm going to give you another example of what you can do in cases like that. Now, if you take somebody, let me see if I get to a set where the models are together in here. And what you can do is you can strip the teeth right in between every tooth, and you can strip the bottom teeth too. It's the same way. In other words, you make a very, very slight difference in there where you run through their contact points. And now we're going to close the spaces in between the teeth that we have from the back side. In other words, we would come down here and hook up some elastics on that, and that closes the spaces up above from the back to the front. And you'll have to think about this to figure it out now. And while you're pulling these teeth forward and closing the space, you catch these and you pull them backwards to get the case. Now, if you do that, you're going to change where these points go through the teeth. That will move these points to the front and move these points to the back. And then as you bring the teeth together, they have to bring their jaw forward to do that. And so I'm going to draw some teeth. Just draw the bicuspid out here, and on the bottom, say you had a bicuspid like that up here, like that. Now, if you open these spaces and close them from the back to the front, you're going to add all this space together. So this deal here is going to move out to here somewhere. And you've got space on the bottom, and that's going to move this back about that much. Now, somebody can take their jaw now. The jaw wants to go where it doesn't hurt the joint. The jaw will just automatically move to the front and go in that space. And that's the way you deal with a case like this. Now I started working on this, and we took every case that came along, And I think that every dentist ought to know what's happening in there. Your occlusion can definitely cause the jaw to hurt back here on these deals. I had a lady one time that had a central tooth, and she went in and they crowned that tooth. But the guy didn't want to take anything off the back of the tooth, so he made the crown thicker on the back. Well, as the tooth came down, it hit this tooth, made it sore, and so the person that we were working on, moved the jaw back a little bit to keep pushing the tooth, keep from pushing that tooth, making it sore. And he made the jaw go back, and where the condyles went into the fossa up here, it pushed that condyle back in there, see? And so they had to bring this condyle forward so that it would not touch here, and we put pressure on that retrodiscal tissue. That's the serious. About 90% of the TMJ problems I ran into over the years had to do with the lower jaw being locked in here and couldn't go back, and it forced the jaw back further. You open it up, free it up where the jaw can move forward, and the pain goes away. So let me run through this case, the rest of it real fast. We open that up, we close those spaces. Now here we go on this case. We're gonna pull these teeth forward, you see. We're gonna come off of here and go down, and over here and come down. And we're closing the space up here between these teeth from the back to the front. These teeth go from the front to the back. Now that makes this where you're free to bring the jaw further forward and close where they go into the groove. And that solves your TMJ problem in this case. And this is what people wouldn't understand at first. Now you got wisdom teeth coming in here. There's one here, there's nothing up there. So those may cause a problem in it. So we move those teeth where they had some space up here, and then bring the jaw forward for that. So went from there to that. Now that, we took some transcranial x-rays of the jaw joint, and you can kind of figure out where the condyle is in that kind of situation. And we moved it from there, brought it from here to there, and we made room in there where they could move their upper teeth forward. One thing, we just increased the space up here, and that worked on this particular case. Now this looks like a simple, everyday case but if somebody's just getting into dentistry, they wouldn't realize they could create a TMJ problem just by moving the teeth over from the class 3 position to the normal position in there. So that's where we did that. And we put her in a retainer with a bite plate, and that's, we cured it. She never had any other problem with the TMJ. Thank you for watching, and I'm going to close out here now, and I hope you enjoy watching these videos. We're hoping to help dentistry all over the world doing things. So thank you. Now I'm going to close out, say goodbye.